Hey everybody, welcome back. We are talking about the bones, the skeleton, and now we are going to move forward to how those bones fracture, the different types of fractures, and how they will repair themselves. So, fractures are breaks, essentially. So, when we say a bone is fractured, it means that it's broken. Most of the time, it results from trauma until we reach an age where we have loss of bone mass due to osteoporosis or just general aging, essentially. And then the bone weakens and then breaks from sometimes just regular use. So we're going to talk about how we can classify those fractures or bone breaks. There's three of the what we call either or type fracture classifications. And so the first one is the position of the bone after the fracture, like where's the broken end, right? So if it's still where it should be in a normal position, but it is broken, then we refer to it as a non-displaced because it is still in the same place. However, if the bone needs to be reset because the ends where the break occurred became displaced or they're out of place, that is a displaced fracture. The completeness of the break tells us about whether it's complete or broken all the way through, or an incomplete fracture where we do see fracture lines, or maybe even some chips, but we don't see that the bone is broken all the way through. And then the last one is one that most people are most familiar with, and so that is whether the skin has been penetrated and the adjacent tissues have been damaged. So if we have breakage of the skin, we have a lot of bleeding, and you can hopefully not, but probably will see the bone through the skin. It's penetrated. It is the compound fracture. And so when we have it closed, however, and the skin is not broken, but perhaps we're having some swelling, definitely some pain, we consider that a closed fracture. So it really, the open and closed part is the skin open or is it closed? Is it a compound fracture or is it a simple fracture? Um, Also, we describe it by location, like where did it happen? Also, how does it look on the outside? And then some other features of the nature of the break. So we'll talk about. In this case, we have a comminuted fracture and a compression fracture. So the first type, the comminuted fracture, is when we have, like, say, someone steps down really hard and puts the vertical force down on a bone and it actually just breaks. This is common in folks that have brittle bones or they're aging. A compression fracture, sorry, is when the bone is actually crushed. And we see this commonly with like a crushed vertebra, as you can see here. The next two are the spiral fracture as well as the epiphyseal fracture. So a spiral fracture, this is common in sports and also is a domestic violence sign. So especially in the wrist, right? If someone grabs radius and ulna, or you twist your knee really hard in sports, it's a ragged break, and it sometimes can happen with a few fracture lines. Epiphyseal. So we've been talking about that epiphyseal plate. That epiphyseal line is being made out of like connective tissue, cartilaginous type tissue. And this would be when that cartilage actually breaks. It can be due to a few different reasons, right? So maybe calcification is not completed. Cartilage cells are dying off at a higher rate than they're calcifying. So that might be more of a youth break. Depressions, and so these would be common causes of, say, skull fractures, so blunt force trauma, car accident. The bone is typically pressed inward. And a green stick break, which is one that happens a lot in kiddos, and this happens when the bone is actually still a little flexible, and so it kind of is this incomplete little bit of a true fracture. It looks like um, like when your windshield cracks or breaks a bit. So that's kind of how it is. Like a twig break is the thought behind it. All right, so those are some of the kinds of fractures that you might, just need to be aware of. Um, so let's look at how bone starts to heal itself, because one of the things that's important is that bone is highly vascular, which means it has a lot of blood supply and it's able to do the healing stages pretty quicker than some other tissues such as ligaments and tendons and even cartilage itself. Okay, so the four things that have to happen is number one, a hematoma, or this giant like bloody capsule, has to form. The next thing is, remember how we used fibrocartilage and hyaline cartilage to actually build the skeleton? Sorry, hyaline cartilage. Well, a cartilaginous callus will start to form, and that'll give us like a bit of a matrix to kind of start reossifying. Finally, when that becomes more calcified, we refer to it as the bony cartilage, because now it's commuted from being cartilaginous to being osseous, or made of bone. And then finally, we have to kind of clean it up, basically, because it doesn't always go down really pretty. And so we have bone remodeling to get us back in all the little detailed, perfect places. So let's take a look at what that actually looks like. Okay, so here is the hematoma. We are lucky that this is not an open fracture, right? So this is not a compound fracture. And so in this case, we still have the periosteum in place. So that is helpful in containing that leaking blood supply and allowing for that big hematoma, which is essentially kind of like a giant clot, to form. Okay, so once the clot is formed, what ends up happening is the blood vessels start kind of going in and rebuilding themselves, because they're getting all of these growth factor signals from all of the cells in the area saying, hey, we've got inflammation, we've got problems. And that's the kind of the neat thing is blood vessels actually really respond to different types of growth factors sent out by cells in the body. And so they will start um, working that area. And then you will also see these new blood vessels start getting laid down in the matrix. That matrix generally is that fibrous tissue, that cartilaginous tissue in here, semi-flexible, semi-solid. And then also, you'll start seeing these teeny tiny little ossification centers. And here's a couple right here. There's a few. Okay. So those, it's like maybe there. Okay. Yeah, ossification centers, right? Just all over, kind of like cropping up. And they are all going to be making the same type, which is going to be that trabeculae, that spongy bone, the diploe, all of that. And what you're not going to see is actually cortical bone. So it's just really important that you understand that the first thing that happens after we're going down with all of the cartilage is going to be spongy bone, right? And so because of that, it creates kind of this like spongy bone protrusion, right? And so we have spongy bone here going through right, so we have spongy bone here going right through where the cortical bone originally was, as you can see, extending towards the outside of the break. And so although we now have ossified bone, we've repaired it, we've replaced all that cartilage, we kind of got these lumpy areas, or lumpy, and it's also very brittle still. It is not completely healed, okay? So it's a little thicker on both sides. So what ends up happening in the final stage is what we call bone remodeling, right? So we're going to kind of start resorbing some of that extra trabecular bone, as well as replacing the trabecular bone where the cortical compact hard bone is on either side of the original fracture. So we can get back to our nice like vertical compression, right, type flat bone. I'm sorry, not flat bone. I'm imagining this is like a flat bone break. A vertical compression, right? Nice, thick, heavy outside cortical bone. And yeah, that's really it. That's the stages of healing in the bone fracture. So as you can see here, again, just to recap. So we have, and this is the case of a not a compound fracture, right? So these little simple breaks are going to be, hopefully, you'll still be enclosed by the periosteum, which can hold in the hematoma, which essentially is a large blood clot. That blood clot evolves into this new fibroblast types of cells come in and start putting down cartilage. right? Fibrous tissue and cartilage kind of just to keep everything together and provide a scaffold for these brand new little centers of ossification where the bone in trabecular bone is laid down. All these little tiny brand new blood vessels are also laid down in response to all the growing cells and the growth factor and all that good stuff. We vascularize the area and rebuild those blood vessels. We are left with not the prettiest scene, right? Ooh, look at that one. Right, not the prettiest scene in this area. It's a lot of trabecular bone. It bulges out. It's in the place of where all of the cortical bone should normally be. So, although we now have ossified this area, we need to get the correct type of bone there in order to maintain stability and to be able to respond to pressures and force. And that, of course, is going to be that cortical hard bone. Orange looks good, right? Which eventually gets put down last as the extratrabecular bone, spongy bone, diploe gets resorbed, and the final new organized osteons of that cortical bone are laid down. Actually, probably more vertical. Okay, so I hope that was helpful. Don't break any bones if you can help it. And I hope you're all out there somewhere having a really terrific day. Okay, bye-bye.